So, good morning. Let me take this opportunity to welcome you to the historic Tougaloo College campus. I'm Luther Kane. I am glad to be here, and we are absolutely ecstatic that you have opted to join us this morning. So, give yourselves a big round of applause for being here. We are absolutely grateful. I'm a part of an organization called Mississippi Faith in Action. It's a collaboration of faith leaders across the city of Jackson and the state of Mississippi. And these faith leaders, they are on the front line leading the charge of some health disparities in our state, in particularly HIV. And so today we're going to uplift a collaboration that we have with these faith leaders. At this point, to bring greetings on behalf of Tougaloo College, we've got to welcome the chaplain of Tougaloo College, Dr. Maxine Bolden. I'm not seen her in a long time. It's good to see you. Come on, ma'am, and bring greetings on behalf of the president of the university.
Good morning and welcome to Tougaloo College. It is a joy to have you all here, and it is a gift for us because we are continuously working in the areas of social justice. And health is a social justice issue, particularly here in Mississippi. And so it is my joy and my delight to welcome you on behalf of our president, Dr. Carmen J. Walters, and all of our faculty, staff, students, administration, and our alums. We hope that you are going to learn and grow and experience and be motivated to go forth and to serve our community around this particular issue. So welcome again. Thank you for being here.
Thank you, Dr. Bolden. We do appreciate that. And so, you know, the Bible declares that we should do everything decent and in order. And with that charge, we're going to welcome one of our leading pastors who has been a part of this work since day one. In fact, he is responsible for introducing me to Dr. Amy Nunn many years ago. If you would, welcome Bishop Ronnie Crudup, who is the lead pastor of New Horizon Church International.
Good morning. Good morning. And Elton, thank you so much. It is wonderful to be first back at Tougaloo College, one of the great colleges and universities in this country. And I'm here really proud to be here with this group, Faith in Action, and particularly to take a stand, public stand around HIV. I've been involved in this actually work now for over 25 years. Years ago, back when we didn't even use that word HIV, and even before AIDS was something that was kind of known in this community, a really good friend of mine actually developed AIDS and talked to us about it and what was going on with him, and it changed my life. And then after that, end up having actually a member of our church who got really sick and nobody could say exactly what it was. And eventually we came to the conclusion that was AIDS. And over the years, once again, I just keep seeing people who were involved, who came down with then eventually HIV. And I had to say, you know, this is a fight that I need to be involved in, because as a Christian, as someone who is a lover of Jesus Christ, I had to understand that Jesus was a strong advocate for health, for community. We all know him as a healer, but the reality is Jesus was a strong advocate for good health in the community among all people. Not just, once again, being sectarian and those folks that are just in your little group. Because the reality is, so goes the community, so go all of us. And so I pride myself on trying to be loving. And the reality is, if you are loving, then you go to the aid and the rescue of people, whoever they are, wherever they are, regardless of, quote, their lifestyles or whatever it is, but you go and be that loving person and give good care. And so I am so pleased to be involved once again with with this group, with Dr. Nunn and Oath and all of these folks in Faith in Action, because there's no doubt this is the right fight. And I'm particularly pleased that we can start talking about ending this epidemic in Jackson, Mississippi. God bless y'all. Oh, am I praying? You didn't tell me I was praying, Oath. I thought you said, okay. Now I can do that. Okay. Let's pray. Father, how we praise you, we love you, we praise you, particularly as we are here doing Holy Week, as we're coming up on Easter and celebrating the resurrection. We thank you for the privilege to be here and talk about things that we know you have a passion for. And thank you for all the people that are here and the difference that they are making. Bless this occasion and our work. And my prayers in Christ's name. Amen.
Let's give Bishop Crudup another round of applause. Bishop has been on the forefront for a very, very long time, and we're absolutely grateful for the work that you do. I'm going to bring up Dr. Amy Nunn, who is the brainchild behind Mississippi Faith in Action. She's been working with Black clergy for a long time. She's been in Mississippi doing this work over a decade. One thing that I know for sure is there has not been a pastor, Pastor Henley, to tell her no, right? No pastor says no to Dr. Amy Nunn, but she's the brainchild behind Mississippi Faith in Action. Additionally, she serves as the professor of public health and medicine at Brown University. I think most of us are aware of the Brown-Tougaloo connection. She is also the executive director of the Rhode Island Public Health Institute. Please welcome Dr. Amy Nunn.
Good morning, everyone. Thank you for having us. I want to start by thanking all of our partners at Tougaloo and the president and the chaplain and everyone that has made this event possible. You may be wondering, why is a professor from Brown here in Mississippi? You can probably tell from my accent that I am a native Southerner. I'm originally from Arkansas, and you may also know that Brown University has been working with Tougaloo since the Civil Rights Movement and the 1960s. So we're thrilled to be here today and always. And I first started working in Mississippi in 2012, and it was actually Bishop Crudup who told me, you need to meet Other Kane. He's the other person who's really passionate about HIV and HIV prevention. So I'm thrilled to be here again today. Y'all know that we're really at the heart of where some of the civil rights movement started, right here at Tougaloo and on this campus, but around the city of Jackson. I was reminded of that yesterday when I was at the Capitol on the steps and looking at all the signs that reminded us about all the protests that took place. And we have made so much progress, but we still have a long way to go. And y'all know that every day that we have lots of civil rights challenges. Sometimes it's overwhelming to think where to start, and HIV and health are some of those challenges. The health disparities around the country are alarming, and in Jackson in particular. Jackson has some of the highest rates of HIV infection in the country. And it is something that is disproportionately impacting young people and people under age 25. And there are a lot of myths out there. A lot of people think this is something that only happens to other people. It doesn't happen to me. This is something that's happening to our young people. It's something that's happening to Black women around the state of Mississippi and in Arkansas, where I'm originally from. The good news is we have so many tools. There's so much we can do about it. And the tools have gotten more and more simple over time. Testing, it all starts with HIV testing. We all need to get tested. Anyone who tests positive can be easily treated with one pill once a day. Most people don't know that people can live long, healthy lives if they just take one pill once a day. You can have a normal life expectancy if you're HIV positive. We also have one pill once a day that people can take for prevention. So if you think you might be at high risk for HIV, you can take one pill once a day that can radically reduce the chances that you contract HIV down to almost zero with one pill once a day. 10 years ago, 15 years ago, we didn't have such great tools. And we really want to help spread awareness about this, how easy it is to reduce HIV transmission, how easy it is to get tested, how easy it is to get treatment, how easy it is to get a medication called PrEP or pre-exposure prophylaxis. Just one pill once a day can solve a lot of challenges, a lot of problems. I think there's been a common perception, and I would even say misperception, that African American community leaders and pastors are unwilling to take this on. And the reason that we started Faith in Action is because we saw so much opportunity to work with Black pastors. Every time I've asked Black pastors to get involved, they've always said, of course I'm going to get involved, Dr. Nunn. This is affecting my community. What can I do? And so the reason that we're launching this initiative, and the reason we think it's so important to have media involved, is to bust up all these stereotypes and these misperceptions, and also for clergy to affirm the dignity and value of people living with HIV and everyone in our community. We think it's really important to elevate clergy voices in the fight against HIV. And that's why we're launching this really important initiative today. So I'm absolutely thrilled to be here. I want to thank all the clergy that have been working with us. We've been doing this work since 2012, but today is really a new beginning because we're really starting a massive testing and treatment campaign around the whole city. And we hope that you can join and partner with us and help spread the word. So thank you so much for being here. I'm thrilled that you're all able to join us. And I want to thank all the pastors who are involved for their leadership on this important initiative. Thank you.
And you can tell Dr. Nunn has been working with Black clergy, right? Black pastors. I thought I was going to have to come and pull a coattail, just a little bit. But she highlighted some of the pastors that are in the audience. So all faith leaders in the audience, please stand. We just want to recognize you at this point. All faith leaders. Thank you very much. Thank you all for being with us. Your jobs are so important in this work, and we are absolutely grateful. It gives me great pleasure to introduce to some and present to others Dr. Thomas Dobbs. When you see him, you'll see him looking very refreshed. His hair is not down to his shoulders anymore, right? His hair is not down to his shoulders anymore. He was extremely instrumental in leading this state through COVID, and we are eternally grateful for his leadership. I think that deserves a big round of applause. But he is stress-free now because he serves as the medical director for Crossroads Clinic, and he's the dean of the John D. Bauer School of Population Health at UMMC. And I am privileged to call him my friend, Dr. Thomas Dobbs. Thank you, David.
And feel free to grab my shirt and pull me. Hey, good morning. Thank you so much for being here. It's great to be at Tougaloo. I love this place. I feel like it's an inspiration for the city and also for the state, a place where so many great things have happened for Mississippi, but I think for the rest of the state too. And I'll tell you, I always love working with y'all's graduates. Always proud to. And that's one of the reasons why Brown keeps stealing them. So we'll have to work on that. Keep more of them here at home. So I also want to thank the faith leaders for being here, and Bishop Crudup especially. He's been inspiration to me for many years, and it's just really great to be here with him again today. I'm really excited for the faith leaders to be more active in the fight, to inject the element of love into the people who might be affected, who are affected with HIV, and into the communities. So does everybody here have their favorite parables? Their favorite parables? I mean, being in Holy Week, it's a good time to think about our favorite parables. And my favorite two are the Good Samaritan. I think that's pretty obvious. I think that most of Mississippi could read that one a few more times, maybe sometimes. And then, but probably my favorite one is the 7 talents, right? And I see that all the time. I see it where people have something to give. They have a gift. They have something that can make a difference, and they don't use it. And I think that this is a skill. This is a place where our faith communities have a real capacity to help people, that can look to those who are in need. People don't know they're in need, who might need counseling, who might need guidance, who might need support. That's really where the strength of the faith community is. And so I think that phenomenal things can happen through y'all's work. I don't know that people know this, but in the state of Mississippi, Black folks survived the COVID pandemic far better than white folks. Did y'all know that? I think we're one of the only states, if not the only state, where Black folks survived at higher rates than the rest of the state. Now, why is that? That's one of the reasons. It's exactly one of the reasons. Some of the reasons is folks paying attention to science and having the love of their community, that they were willing to make hard decisions that were in the best interests of their parishioners, not in the best interests of the collection plate. I know y'all saw that. So the other thing is listening, understanding, making sure people had the best information so that they could survive the pandemic. So what we need to do now is to help Jackson and help the state of Mississippi survive the HIV epidemic. So why do you think that people in Mississippi and in Jackson specifically have higher rates of HIV? Is it because they have riskier behaviors? It's not. The risk behaviors that people are doing here are not worse. It's just that there is more HIV there, and so your chances of getting it are a lot higher, right? And why is that? Is it because we're underinvested in our healthcare infrastructure? Is it because we're underinvested in public health? So we have a systematic structure that puts us at a disadvantage to start with, and we need y'all's help to reverse that. We got to have y'all's help. So like Dr. Nunn said, and we're super excited to have her partnership, there are tools at play that we can bring people to connection with to make a difference. There are medications that can prevent HIV infection. Just one pill a day is almost 100% effective for folks who'll take it. And if people have HIV infection, if we find it early enough, they'll be healthy and live a normal lifespan and won't share it with anybody, right? So we just got to connect people with resources. I'm fortunate to be working at Crossroads Clinic in the medical mall, and people need to get tested. Everybody needs to get tested for HIV. CDC recommends that every single person be tested for HIV. I have been tested for HIV because everybody needs to be. And some people who are at risk need to be tested more often. So we need to normalize it. We need to destigmatize it, right? And we need to connect people with resources. So we also offer PrEP, pre-exposure prophylaxis medications at Crossroads Clinic and other places around the state. So encourage folks to go to the PrEP locator if you might need it. And you don't have to have insurance. We will make sure that folks get it. That's one of the few things where we have resources where we're committed, regardless of ability to pay, we'll make sure folks get what they need. So anyway, look forward to working with y'all. I work at the Crossroads Clinic periodically in the medical mall. So look forward to seeing anybody who might need our help. And just want to say thanks again to Tougaloo and thanks again to the pastors and faith leaders here today. I think we can make a real difference. Thanks, y'all.
Thank you, Dr. Dobbs. Let's give Dr. Dobbs another round of applause. I'm always amazed when we talk about stats, right? I'm always amazed when we talk about stats. And so to be on top of a good stat during COVID is a good thing, right? So kudos to you. Faith works, right? And African Americans, we depend on our faith, right? So faith works. So kudos to you. Dr. Dobbs and Dr. Nunn talked about this one pill once a day that you can take. Well, coming up next is a young lady that's going to tell her story. And it's a personal story, but I think that you will absolutely be moved by that. And she was encouraged to go to the doctor because of being in church, and her first lady encouraged her to do that. So LaTanya, come up, please. She's also a fellow with Dr. Amy Nunn, and she too is from Arkansas, right? She's from Arkansas. Come on, LaTanya.
Good morning. Thank you for having me. I'll be brief, but I did want to share my story. So I am an instructor at University of Arkansas for Medical Sciences, but on top of that, I am also a person living with HIV/AIDS. When I was, I don't remember, 1997, I'll go back there with the year. I lived in a little small town called Prescott, Arkansas. I was in the church, still in the church, so I thank God and give him all honor and glory for allowing me to be here. But I missed a night of revival at church one night, and I went by my pastor's house because we were really close. Now, to set a little tone to that, I did not lose my virginity until I was out of high school and gone to college. I did not have that many partners, and I was engaged to be married at the time. So when my pastor's wife came to me and told me that someone had prophesied at church the night before that someone had HIV/AIDS, and she asked me to go get tested, it didn't really even cross my mind because I knew that she was a trusted member and I knew that she would not guide me in the wrong direction. So I didn't ask any questions. I just followed her direction, even with knowing everything that I knew and not really knowing anything about HIV. When my test results came back positive, I kind of already had that feeling, but I knew that God would take care of me. And so after that point, I trusted in God to lead me down the right paths. I can say that I've been living with this disease since 1997. I've not had any issues. My children were born without the virus because I did have one child during that time. And I was able to meet some awesome people who have led me to where I am as far as getting my degrees. I earned both my bachelor's and my master's degree even after a diagnosis. So I say to people, if you are diagnosed positive, and don't be afraid to go get a test, you can live a full and happy life. Thank you.
I think that deserves a little bit better than that, right? To be brave enough to articulate your story in a public forum is absolutely amazing. So thank you for sharing that. We certainly do appreciate that. It gives all of us hope. Jennifer Beard is up next. When you talk about leadership, I think Pastor Beard takes leadership to a whole new level. This lady's doing some amazing things. She and the Jackson Revival Center over in South Jackson and across the city and across the state. Pastor Beard probably does not understand the word no because she never says no. And I am thrilled that she is here. You slid in right on time, my friend. You're up next. Pastor Jennifer Beard, the senior pastor of the Jackson Revival Center.
Well, we thank God for the opportunity to be here with you on today. And just to share a little bit about when God dropped the burden for ministering to people dealing with HIV. I was attending school, pursuing my MDiv at Virginia Union University, Samuel DeWitt Proctor School of Theology. I was sitting in a general assembly in 2014. And during our general assemblies there, they would begin to deal with us about things that were plaguing the nation that the church was silent about. And they began to put stats up on the screen for everyone in that general assembly to see. And Jackson, Mississippi was at the top of that list. And I said, how is it that I'm pastoring in Jackson, Mississippi, and I don't know that our city is leading the nation in HIV? And so it was at that time that I began talking with Dr. Ruby Denson, who is over our health and wellness ministry. She's here today. I want to acknowledge her and give her a shout out for the amazing work that is being done. But it was during that time that I started asking her, really, what can we do? I started finding ways to just say things and messages to really begin to pull people's hearts toward the need to realize this is ministry. And one of the things that I began to realize is that so many pastors and churches were silent on this issue. We would talk about things dealing with the heart. We would talk about other things. We would push other agendas, as far as it relates to health and wellness, mammograms, prostate exams, things of that nature. But I said, we need to start working this into our health and wellness. And so some of the things that we've done, obviously on World AIDS Day, I try to somehow include that in my sermon. We try to talk about it. We also do regular testing. We have partnered with other organizations throughout the city, Mississippi Faith in Action, My Brother's Keeper. There's a few others that we've partnered with since that time as well, because I started talking about it from the pulpit. Members of our congregation began coming to talk to me. And they were happy to have a safe space where they could talk about what they were going through, what their needs were. We've also done Zoom meetings where people would sign up and they could come and receive information they needed as far as next steps for care after testing. Also just providing a safe space to talk about what they're going through, caregivers, supporting other organizations that offer care. And so those are some of the things that we have done. And so as a pastor, I want to make sure that we understand it's important not to be silent, that we're about ministering to the whole man, and that means ministering to the totality of those needs. And so prayerfully, other pastors and other churches, I know there are many, Bishop Crudup and many others who are doing the work as well, some of them well before us. But I just want to encourage every pastor, every leader. I think about the story of the Good Samaritan, where there was a man who was in need, who had fallen among thieves and had been left to die. And so many of the people that I have talked to have felt like that person who was passed by so many others, that others went the other way to avoid talking about things that were uncomfortable to talk about. This has also been many times promoted as a virus that only affects certain people, but it affects everybody, regardless of race, regardless of age, regardless of gender, regardless of who you're in relationship with. This is something that affects everyone. And so I believe that the heart of God is not to walk the other way, not to move to the other side of the street, but to come, pour in the oil and the wine and say, what can we do to be a help and to be a support? All right, God bless you.
Let's give Pastor Jennifer Beard another round of applause. Thank you so much. We really do appreciate that. And Pastor Beard can always get a word in. I love it at any time. I love it, no matter where. And she lifted Dr. Ruby Denson up, and I want to give her another shout out. Thank you for your work. Thank you for your leadership. And there are others in the audience that do amazing work, and it's really good when we can collaborate and unite. I see Juanita Davis. Please stand for Care for Me Services. She leads that organization. They do absolutely amazing work. And I saw Valencia Robinson with Mississippi in Action. I don't see her. Oh, there she is. Stand, Valencia. There she is. So these ladies are doing amazing work, and they have their team members with them, and there are others in the audience as well. So we certainly do appreciate that. Dr. Amy Nunn is going to come back and do the great reveal.
Y'all know what the most important thing I've learned since I started doing this work? Never, ever, ever go after a pastor when you're speaking. I'll be super brief. Why are we here today? We're launching a big social marketing campaign to help raise awareness. So it'll be in print media, TV, on social media, and it's all really intended to help fight stigma and to encourage people to get tested, treated, and to explore PrEP, pre-exposure prophylaxis. So just want to, and it's really designed to elevate the voices of our community leaders here in Jackson. So we just want to now show you a couple of our videos. You may be seeing our ads on Facebook and on Google and other places. And I hope you share them and help us spread awareness. But let me just show you what some of our videos look like.
HIV is spreading in Jackson among both men and women.
With infection rates as high as many countries in Africa.
But if you're at risk or test positive for HIV, most people can take one pill a day.
One daily pill for prevention,
One daily pill for treatment.
Learn more at MississippiFaithInAction.com.
And get information about free private HIV testing.
we can stop the spread.
Mississippi Faith in Action.
.com.
Can I get an amen? I got tested.
I got tested.
I got tested.
All men and women should get tested for HIV.
HIV is spreading in our community,
With infection rates as high as many countries in Africa.
but we can stop the spread.
Testing is free, easy, and private.
And we will save countless Black lives.
Get testing information at
Mississippi Faith in Action.
.com. Can I get an amen?
So thank you so much for being here. I'm going to hand the mic back to Other.
All right, y'all like that? Looks good, right? All right. And don't worry, it was just a delay because we're live streaming. They're really in sync and they really work, all right? Just wanted to point that out. All right, so we're going to change gears just a little bit and call on my dear friend, Pat. Pat does a lot of work in the area of HIV because she does a lot of work in a whole bunch of different areas. And she is a gifted songstress. So please welcome Pat Smith.
I was born by the river in a little tent. Oh, and just like that river, I've been running ever since. It's been a long time coming, but I know a change gonna come. Oh, yes, it is. It's been too hard living, but some are afraid to die, 'cause they don't know what's up there beyond the skies. It's been a long time coming, but I know a change gonna come. Oh, yes, it is. I go to the movies, then I go downtown. They keep telling me, don't hang around. It's been a long time coming, but I know a change gonna come. Oh, yes, it is. Then I go to my brother. I say, brother, help me, please. But he winds up knocking me down to my knees. There've been times when I thought I wouldn't last for long, but now I know I'm able to carry on. It's been a long time coming, but I know a change gonna come. Oh, yes, it is. It's been 42 years in the coming times, but a change gonna come.
All I can say is I told you so. Let's give Pat Smith another round of applause. Job well done. Job well done. Job well done. I think that's the charge we need to get in this fight and to stay in this fight. Joining together, joining hands together, we can win this thing. We can absolutely end the epidemic, right? But not one person. All of us together in this room, all of us, hand in hand and in lockstep, we can bring an end to this epidemic. And so today, your charge is to go and tell somebody, right? Pull somebody else into this work. Let's give all of our faith leaders a round of applause, because we absolutely could not do this without our faith leaders. We are grateful for you. We are grateful for your leadership. We're grateful for you opening the doors and allowing us to come in. I mean, we've done testing events inside of churches, and we are more than willing to do those again. Amy, we've got to bring you back just for some final words, and we are done.
I'm just going to close by saying, yes, we can. Thank you all for coming, and we will be in touch. We're going to be reaching out to all of you for helping this initiative, and thank you for being here.